Dozens of drunk University of South Carolina students are overloading the emergency room and causing mayhem at our local hospital. Nurses at Palmetto Health Baptist said they mostly get underage drinkers who wreak havoc on the emergency room following the university's home football games. They try to run away, fight people and pee in the corner, one Palmetto nurse told the state. Other nurses revealed that once the games are over, stretchers line the hallways with drunk students, causing a strain on resources at the hospital for those who are actually sick. Palmetto Health spokeswoman Tammy Epps said in a statement to the news site that like any large influx of patients, this places a strain on the emergency department, especially since many of these patients may not require medical treatment. Another nurse told the news site that some students can be violent. It's unclear how many students are usually treated at the hospital following a major event like a football game, but during a recent game at least 15 students were treated at Palmetto Baptist at the same time. Share this article. Share the students are usually treated for excessive drinking or drug-related reason. Most of them are 18, 19 years old, one nurse told the state. One of them wasn't even 18 years old. The most popular time of year for students to take a trip to the hospital for excessive drinking is in the fall months of September, October, and November. Some students come into the hospital with the blood alcohol level of 0.20 or 0.30, according to the state. We get kids we have to intubate, we have to breathe for them, because they drank so much or got into some drugs, one nurse said. And it doesn't matter how drunk students are when they arrive, because they still have to be treated. Federal law requires emergency rooms to treat anyone who comes to the ER. The problem doesn't just affect the nurses, it also affects EMTs. Once EMTs respond to a call about a drunk student, they are unable to leave the scene to treat someone with a more serious injury. In order to alleviate the issue, there is a university program that screens students to determine whether or not they're at risk for continued drinking. According to the state, the students are then set up with motivational interviews with counselors who help them get their behavior under control.